Good afternoon and welcome to the third annual Northeast North Central Pennsylvania IPEC Collaborative Care Summit. The goal of this summit is to allow students to learn from, about, and with each other. As part of the learning process, we've prepared a short video to give you a better understanding of how each profession contributes to the care of our patients. We hope you enjoy it.
Hi, I'd like to begin by introducing myself. My name is Srivat Prem Kumar. I'm here enrolled in the Johnson College Radiologic Technology program. Radiology was first discovered in 1895 and ever since it's always been changing. You can see us working in outpatient departments, doctors' offices, and in hospital settings. Within the hospital settings, we as radiology technologists work with different doctors and other specialists. We travel throughout the hospital, working in the OR, ER, and even in the nurseries, while on portable exams could take us to patient's room or sometimes even to the morgue. A radiologist technologist works in a highly advanced medical field, which also requires excellent people skills. In addition to learning numerous positions required to obtain a medical image, we also have to be well educated in different anatomy of the human body, variances of different pathological conditions that might influence the final image. Along with positioning, a radiologist technician is also responsible for radiation dosage of the patient. We have to understand the dynamics and the mechanics of every machine and how X-rays are produced. It is important to understand the biological effects on the patient because there's no such thing as safe level of radiation. ImageWise is a campaign to educate referring doctors, radiologists, and technologists on how to minimize patient dosage. It is our responsibility to keep the radiation dosage as low as possible while taking the best possible diagnostic image. In conclusion, I'd like to state that as a radiologic technologist, we work as a part of the collaborative team that encompasses the imaging modality and patient care that will leave a positive experience.
Hi, I'm Sarah and this is Erin. We're students here in the Physician Assistant Program at King's College. We're here today to tell you a little bit about the PA profession and how we fit into an interdisciplinary approach to patient care.
A PA is trained to provide direct patient care services in partnership with the physician in any and all fields of medicine or surgery. We perform history and physical exams, order and interpret diagnostic tests, establish diagnoses, implement treatment plans, write prescriptions, and provide follow-up care and referrals as necessary. We also perform minor surgical procedures, and patient education is an important part of the care we provide.
You'll find PAs working just about anywhere, in the office or in the clinic, in the hospital making rounds or assisting in surgery, staffing satellite offices, or providing on-call services in the practice or making nursing home rounds. We also serve as house staff.
As of 2011, there were 81,000 practicing PAs in the United States, and over half of these were in primary care. PAs are nationally certified and state licensed and can practice in all 50 states as well as some other countries.
A PA must have good communication skills and develop rapport with other providers. We work closely with nurses and pharmacists and consult with these and other healthcare professionals to provide proper and complete care to all patients. This includes professionals in the mental health and social fields.
PAs have the ability to move within and between all fields of medicine and surgery, as well as academia during their careers. This is one of the reasons why the profession is so appealing to those interested in a medical career.
The reason I chose to be a PA was because you never know where life is going to take you, and there's always going to be patients in need.
We hope that the next time you see a PA, you have a better understanding of what we do.
Hi, my name is John Brady, and I'm in my final year of pharmacy school at Wilkes University. I'm here today to talk to you about the profession of pharmacy. I'd like to explain what pharmacists contribute to the healthcare team and where you can find us practicing. I'd also like to discuss why many of us chose to join one of the most trusted healthcare professions. The most common area of pharmacy practice is the community setting, such as a national chain, neighborhood grocery store, or locally owned independent pharmacy. In the community setting, you can find us counseling patients on medications and providing recommendations on over-the-counter products and supplements. We are the last point of contact between our patients and their medications. Therefore, we take great pride and responsibility in ensuring the safety and efficacy of the medications we dispense. We value our accessibility to patients and encourage them to approach us with questions whenever possible. In addition to providing valuable information to our patients, we work closely with their physicians, tailoring drug regimens to meet each individual's needs. We also offer some unique services, such as diabetic footwear fittings, and we protect public health by administering immunizations. The hospital is another setting where you can find many of us. Hospital pharmacists commonly work as part of an interprofessional team, rounding with physicians and other practitioners, providing evidence-based recommendations regarding the appropriate use of medications. We also help to control costs by managing drug formulary systems. And when our patients are ready to go home, we provide discharge counseling, ensuring that before they leave our care, they are comfortable with and knowledgeable of their medications. An emerging area of pharmacy practice is ambulatory care. Ambulatory care pharmacists practice in primary care centers, such as a doctor's office or clinic, where we collaborate with practitioners to actively manage the treatment of chronic diseases such as diabetes, hypertension, and dyslipidemia. In conclusion, pharmacists are medication experts. We chose the profession of pharmacy because we believe very strongly that by working with other healthcare providers, we can improve outcomes, enhance care, and impact the lives of our patients. Thank you. I hope you've enjoyed our overview of the pharmacy profession.
Hi, my name's Jenna Harner, and I'll be graduating this coming May from the Pennsylvania College of Technology with a Bachelor's of Science nursing degree. I chose to study nursing because I wanted to make a difference in the people's lives around me. You'll find nurses in a variety of settings, including the community, such as home health, doctor's offices, and educational settings, as well as schools, industry, prisons, long-term care facilities, and most commonly the hospitals. Nurses also serve a variety of roles, including patient advocate, educator, researcher, clinician, manager, and leader. Nurses partner with and advocate for safe, effective health care and meet the needs of clients of all ages, families, and those within the community. Nurses spend a great deal of time educating patients on their disease process, what to expect before and after surgery or treatment, the medication actions and side effects, as well as diet and exercise needs. Nurses will then evaluate the patient's understanding of the material and answer any questions as needed. Nurses are expert clinicians who have a great deal of knowledge and understanding of the patient's condition. We are the final safety net for the patient because we're always double-checking the physician's orders. We serve as the physician's eyes and ears because we spend the greatest deal of time with the patient. We provide consumer-centered care to meet the needs of patients from diverse backgrounds. Nurses are active participants in research to gain a better understanding of medical conditions and seek methods of improving patient care through evidence-based practice. Nurses are leaders within their institution as well as the community, regionally, and nationally. Nurses must be able to delegate tasks appropriately and collaborate with other disciplines in order to improve patient outcomes. Nurses serve in various capacities to change healthcare legislation and ultimately improve patient care and outcomes. Nursing is both an art and a science. Caring, knowledgeable people providing healthcare that makes a difference.
My name is Donnie. I'm an EMT student here at Luzerne County Community College. Basic job of an EMT, we respond to calls that are dispatched to us regarding traumas, maybe car accidents or medical calls. Upon arriving at the scene, our primary objectives are to establish the patient's priority, provide our basic life support interventions such as our basic airway management, applying oxygen, splinting, controlling bleeding and stuff like that. So the information that we are able to gather from that will dictate whether or not we call for an ALS unit for support.
My name is Chester. I'm a paramedic student at Luzerne County Community College. I practice in the advanced life support field and assisting the BLS units on scene with advanced airway management, cardiac life support, IVs, medication administration to ensure patient care and to transport them to the hospital. We ensure to do everything for the patient that we can to our ability. And we hope that you guys learned a lot about our profession and enjoy the summit.
Hi, my name is Megan Dickman. I'm a second-year graduate social work student at Marywood University in the School of Social Work and Administrative Studies. I am studying to be a professional social worker, and I wanted to take a minute just to tell you what a social worker is and what the profession of social work does. And social workers can work in a variety of different settings: schools, hospitals, with veterans, with children, with the elderly. Primarily we work with oppressed populations that can be vulnerable in one way or the other. We help them meet their basic needs so that they can live a fulfilling life themselves. We take a strength-based perspective and work to empower individuals, give a voice to the populations that we work with, and working with our legislators for sound social welfare policies. We work with individuals that can be vulnerable in one way or another, working with oppressed populations. That can be individuals with substance abuse issues, that can be women, immigrants, patients in a hospital setting. I come with a background in a couple different aspects of social work. I've worked with disaster relief, worked with the American Red Cross before, working with individuals after they go through a trauma incident such as a house fire, hurricanes, and things like that. I've also worked with hospice, and in the hospice setting, we're working with terminally ill patients and their families, looking at the whole person, them in their environment, not just the individual and the patient and their medical symptoms, but their whole social environment, their loved ones. We connect our clients with the services that they might need in the community. So looking at just not one issue or one aspect of their life, if it's housing, but looking, to get them mental health services, to get them food assistance programs and things like that. So social workers help individuals, families, groups, organizations, and communities as a whole. They help anybody, everybody, just like yourself and your families.
Hi, my name is Marissa Wright.
And I'm Sarah Scott.
We are students enrolled in the Diagnostic Medical Sonography program at Misericordia University. Sonography is a diagnostic imaging modality that uses high-frequency sound waves to produce images of internal structures in the body. These structures include organs, vessels, muscles, and tendons. The most familiar use of ultrasound is with obstetrics. However, sonography encompasses so much more. Abdominal sonography is frequently requested to evaluate gallstones, renal pathology, and liver disease, to name a few. This is an image of the liver, showing the liver right there, the IVC, and some of the portal vein.
Sonography is also used to evaluate superficial structures such as the thyroid, breast, and scrotum. It evaluates characteristics that may be associated with benign versus malignant.
Duplex sonography is routinely used to evaluate for thrombus or arterial assessment for the narrowing of an artery, which can compromise blood flow to the organ. Duplex is referred to the ability to image the vessel as well as assess the blood flow as it moves through the vessel. This is a 2D image of the common carotid artery. This is an image of the color Doppler that shows the direction of the blood flow. And this is the spectral Doppler, which shows the velocity of the blood flow. This image depicts a 4D sonogram of the fetus showing facial features.
Sonography is extremely cost-effective in comparison to other imaging modalities and is regarded as a safe approach to diagnostic imaging because of its lack of radiation, unlike X-ray and CT scans that require the use of radiation.
In conclusion, sonography is often ordered initially due to the technology being non-radiation and cost-effective. We have the capability to image beginning with the unborn to the geriatric. We image the fetus for fetal well-being, the newborn for cardiac, abdominal, or neonatal head, pediatric and adults for abdominal, male and female pelvis, vascular, and obstetrical. Prevalent exams in the geriatric are echocardiography and vascular. We are happy to be part of the healthcare team.
We have both been assigned a patient who has had a total hip replacement and we will be working together in order to help this patient improve their functional status. And as a physical therapist, my job will be to select the appropriate mobility aid or device and to train its appropriate use, integrate any hip precautions into movement and position changes, design and implement an exercise program for hip strength and range of motion, and transfer safely to toilet, tub, and chair, and this will be with the assistance of the OT.
As an occupational therapist, my job will be to integrate the mobility aid or device into their ADL or IADLs. I will also be integrating the hip precautions into the ADL routine. I will be utilizing adaptive equipment into the dressing routine or the ADL routine, and then we'll be working together for safe transfers.
And these are the hip precautions that our patient will need to follow in order to safely ambulate and get up from chair, toilet, etc. Okay, Mrs. Jones, in order to properly stand up, what I want you to first do is I want you to use the bed and your hands to help yourself get up without bending forward, okay? You gotta remember your hip precautions. So if you can, use your hands to help yourself stand straight up from the bed. Good, now you can grab a hold of the walker and we're gonna walk over to the bathroom. So you're gonna walk over to the toilet and turn around. And I want you to back up until you feel your legs meet the toilet. And I want you to sit down the same way that you got up, keeping your back nice and straight. Good.
Hi, Mrs. Jones. I'll be your occupational therapist today. I'm gonna show you a few pieces of adaptive equipment that you can use to adhere to the hip precautions. So first, this is the socking. What you do is you put the sock on here as you would a normal sock on your foot, and you're gonna drop it down and put your foot in the hole. So we're gonna pretend like there's a sock here just so I can show you how to use it. So, drop it down. Grab a hold of the handles. Put your foot through. Perfect. Okay, great. And now these are other adaptive equipment. Another useful piece is the eraser. So this will help you to avoid bending down and adhering to the hip precautions. Perfect. Okay, great.
How are you doing, Mrs. Jones?
Very good, thank you.
College in particular, because I truly believe that TCMC is changing medical education, focusing on community-based medicine, and serving underserved populations.
In our first 2 years at TCMC, we spent a lot of time learning in the classrooms, the group study rooms, the student lounge, the library, and the simulation center. In our third and fourth years, we get a chance to take the skill set that we've learned out into the community and practice it.
My mom, and I told my dad, and it wasn't until I actually got into medical school that I needed to figure out what kind of doctor I wanted to be.
I joined the military, and I joined as a combat medic, and this was to either reinforce or make me want to become a physician. And the greatest feeling I ever had was being able to help soldiers medically, anybody who had a medical problem.
So I wanted to be a doctor after I started working in a research lab that focuses on neurodegenerative diseases, particularly Alzheimer's, Parkinson's, and Huntington's disease.
We had these samples in isolation for 4 weeks, and then we finally had the opportunity to actually go to the pathology lab at Pocono Medical Center, and we got to meet the pathologist down there who got us the samples, the lab tech who actually cut the samples, and the nurses, who knew some of the patients, obviously.
So I grew up playing ice hockey, and I started to get interested in sports medicine and orthopedic surgery in particular. And but once I came here, they exposed us to so many different medical fields. It really, I think, encourages you to keep your options open.
Yeah, same. I came in actually interested in emergency medicine, but after dealing with patients in our community weeks and even doing volunteer work around the community, I've realized that maybe I want to deal with patients.
Some sort of oncology. And to not only be able to study the disease and see how it's progressing, but then also the more humanistic side of that and work with people.
And lately I've been really thinking that I'd like to do something where you follow at least some of your patients over a long period of time, really get to know them as their doctor, and really build a good, trusting relationship with them over time.
I much prefer the OR setting.
partially because of the dynamics within that team. So in the OR, in the ENT OR, there's the surgeon, the scrub nurse, the circulating nurse, CRNA, and then the anesthesiologist who comes in periodically. I like that group approach to medical care.
All health practitioners, including physicians,
nurses,
pharmacists,
and therapists, among others, need to understand the importance of communicating,
working within healthcare teams,
and coordinating our efforts to provide care that is patient-centered,
high quality, safe, effective,
efficient,
and equitable.
Our performance must be guided by high ethical and professional standards.
And we need to recognize our own limitations, understand each other's roles and responsibilities,
and learn to trust each other, our patients,
and their families.
So students like me,
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 and me can make a difference.